as a dentist mom, which is that one food which you'll never allow your son to eat? It's very harmful for dental hygiene.
So my son is 10 plus and he has never tasted cold drinks in his life.
What are the most common mistakes parents and children make when it comes to brushing?
So there are people who come and say, I'm brushing 2 times a day, still I'm getting cavities. But somewhere they're not realizing, are they brushing correctly? Are they using the right toothpaste? Are they using the right toothbrush for themselves or for their children? And then above 6 years of age, you can move on to an adult toothbrush, a regular toothbrush.
Okay.
Now coming on to the quantity of toothpaste, between 3 to 6 years of age, you have to use a pea-sized amount.
Tell me, what is the effect of bottle feeding, night feeding, and thumb sucking on babies' dental health?
Sugars in the milk, lactose is a natural sugar in the milk. That because it is getting accumulated at night, along with people don't start brushing. They think that these are milk teeth. Generally, they start brushing at a later age.
Tell me, what's the effect of poor oral health on a child's overall health?
So oral health is the mirror of general health. It affects them physically, it affects them mentally, it affects them socially. I have had many young children come to me, I don't like to smile in my pictures. You know, the other child is making fun of me.
Are electric toothbrushes good? What's your stance on kids using mouthwash?
Mouthwashes are not recommended below 6 years of age. Adult mouthwashes are mostly alcohol based.
Also, one more piece of information which I came across. I saw this video of Dr. Sandesh Maikar and उन्होंने बोला that सुबह आपको brush actually breakfast के बाद करना चाहिए, breakfast के पहले नहीं करना चाहिए. Why? Welcome, Dr. Jayna.
It's a complete pleasure to be here, Zahra. Thank you so much for having me over.
Thank you so much for taking out time for having this conversation. सबसे basic but important question से शुरू करते हैं.
Sure.
Okay. At what age should be the first dental visit of a child?
I'm glad you asked that because that's what I keep explaining to my patients. Generally, when they visit the dentist, it's when
कुछ problem होता है तो.
Exactly. The toothache is there, or you get a swelling, or there is some black discoloration. That is when you generally go to the dentist. But ideally, the first dental visit has to be as soon as the first tooth erupts in the mouth, which is generally at 6 months of age, or latest by the first birthday. So no later than the first birthday.
Oh my God, like हम लोग एक्चुअली डेंटल केयर और डेंटल हेल्थ बहुत निग्लेक्ट करते हैं बच्चों में.
True.
उनके वैक्सीनेशन, खाना पीना सब on
track.
On point, but when it comes to dental care, we are like जब problem होएगा तब जाएंगे. I also feel ये attitude है because there are a lot of myths associated with dental health, and I have a couple of them which I want to ask you. तो
Sure.
मैं पूछूंगी, आप बताओ that it's a myth or it's actually true. So babies से चालू करते हैं. Should we use wet cloth, wet gauze or the silicone finger brush to clean the mouth of the baby every time after he or she drinks milk?
Yes. So you can use any of the above, Zahra. Whether it's a wet muslin cloth, you can just dip it in lukewarm water, squeeze it, and then gently wipe the gum pads of the baby after he has consumed a feed. But generally, see, children thrive on routine, right? You make a feeding schedule, you make a sleeping schedule. So what we suggest is that do it once in the morning and once at bedtime. Okay. So once in the morning, either you can use that silicone brush, make sure it's a BPA-free brush, and just put it on the finger and gently wipe the gum pads. Or you can use a gauze piece, or you can use a damp, wet muslin cloth. Any of the above. But morning and night.
Not every time
not every time is generally needed. And also make sure that you're cleaning the tongue as well.
Got it. I actually started this for my son Heather. He is now 16 months old, but around 6 months मैंने ये चालू किया था. But then I stopped it because people started telling me that नहीं, उसके gums weak हो जाएंगे. Someone even told me उसके taste buds destroy हो जाएंगे. तो ये सब होता है क्या?
No. See, even brushing we do only twice a day, right? So just cleaning the gum pads twice a day is sufficient. The children also get into the habit of having a foreign sensation in the mouth because when you're using your hand to clean, so then they also know that yes, this is expected. Similarly, even you get used to the fact that yes, apart from the feeding and the eating schedule, this is what I have to do in the routine, right? So just twice is enough.
Okay, so thank you for clarifying that. Now moving on to a little older kids. The myth is milk teeth don't matter, वो वैसे ही गिरने वाले हैं, so why to take care of them?
Absolutely. So every second patient and their family who comes to me, they say that, why do we need to do any treatment, whether it's a filling or a root canal, because ultimately this tooth has to fall off. But see, milk teeth have various functions. Of course, they help the children chew their food. They make them, their smile look beautiful. They give them the confidence to smile. They help in speech. And most importantly, they also maintain the space for the permanent teeth underneath. So the milk teeth, just under them, the permanent teeth are, developing in a shell or a follicle. Just like the egg is there in a shell, the baby is there in our womb, same way the permanent tooth is also developing in a follicle. Now, any infection in the milk tooth, if it is left untreated, it can spread to the nerve tissue of the tooth. And from there, the infection can travel or penetrate the follicle as well. And that may harm the growth and development of the permanent tooth, because that permanent tooth is still in the formative stage. It is still developing. So, it's like a birth defect. So if at that point of time an infection occurs, then the permanent tooth would get damaged. Other than that, if the milk tooth falls prematurely, or if due to excessive infection we have to remove it prematurely, what will happen? The space which it is holding for the permanent tooth will get lost. So supposedly there are 3 teeth. If I remove one in between, teeth have a natural physiological mobility. They will start moving towards each other. Once they do that, the permanent tooth bud which is forming underneath will not have adequate space left to come out in the mouth. So that will lead to issues like crowding, malocclusion at a later stage, increasing the need and complexity for various treatments, orthodontic treatments like braces and all.
So at any age, dental care is important,
Critical.
whether milk teeth or
permanent. Teeth.
Wow.
Yes.
And now coming to the most common myth, or it's true that you will let me know, is that junk and sugary treats are the only cause of cavity. Is that true?
So see, cavities, caries as we call it in our dental terminology, it's a multifactorial disease. So there are multiple factors which are responsible for the development of cavities, right? What those factors are, of course, you need the tooth, which is the host. You need sugary food or junk food, which is the, in a way, the substrate. And then you need the bacteria, which are the unhealthy bacteria, which are going to cause cavities. And time is a factor. So, in different people, cavities spread or progress differently. So say, for example, a child may come to me with a black spot and there is a small cavity. That black spot may progress to become a root canal or a deeper cavity, say in a year span of time. While for another patient, that cavity may become a deeper cavity very soon.
Got it.
So genetics is also one of the factors which plays an important role. But there is no sole factor. Yes, there may be a predominant factor that this one particular factor is majorly responsible in this particular child, but ultimately each factor plays a part. Other than that, there are other things like your salivary composition, your bacterial load in the mouth, your oral pH, the flow of saliva. So some people have dry mouth. So saliva and tongue are the natural defense mechanisms of the oral cavity. So people who have a dry mouth, they will have a higher chance of developing a dental caries or a cavity. Similarly, people who have acid reflux, even that can cause erosion. So there are a lot of factors. Majorly in children, yes, of course, diet and hygiene are the 2 factors which I say are in a patient's control, and you can take care of that. So those 2 are considered the main factors.
So सिर्फ junk अकेला villain नहीं है.
नहीं है, exactly. Another example, if I may add on. So a patient comes to me and says, I eat 2-3 chocolates in a day, but I brush 5 times a day. And another one comes and says, I don't eat sweets at all, so I don't brush at all. Neither of them works. So there has to be a balance between what kind of a diet you are taking, how well you are maintaining your oral hygiene. They go hand in hand.
Absolutely. So tell me, which are the most common foods that lead to a dental issue or dental health problems in kids?
So anything which is rich in sugar or refined carbohydrates. So, your jams, your chocolate spreads, your energy drinks, your fruit juices, candies, chocolates, ice creams, everything. Your potato chips, even your banana chips, because carbohydrates, fermentable carbohydrates also break down into sugars in the mouth, right? So all these things. And what matters more is not the quantity that is consumed, it is the frequency of the consumption. That matters more. Now, just to explain it to you, suppose a child has a sweet tooth, he's used to eating, he needs some sweet snacks every time of the day. Rather than giving the sweet snacks, say for example a biscuit at breakfast, then at lunchtime, at snack time, at dinner, it is better to give 4 biscuits at one go. So every time you are consuming anything which is rich in sugar, that sugar is getting deposited on the teeth, right? Normally, just to explain the process of how cavities happen, normally there is an ecological balance in the mouth. There are bacteria in the mouth, but normally there is a balance of healthy and unhealthy bacteria. The moment you consume something sweet, the pH of the mouth drops. It becomes acidic in nature. Now, when the pH drops, the unhealthy bacteria, they start increasing in number. Those bacteria, they consume the sugar which is stuck onto the teeth. They consume that sugar and produce a byproduct which is an acid. That acid starts demineralizing or removing or leaching out the minerals from the surface of the tooth, the enamel. Teeth are made up of, enamel is made up of calcium and phosphorus. Now this entire process, when the minerals get leached out, porosity develops, decay develops. So that is how cavities happen. So try and cut down the number of times or the frequency of the acid attack or the sugar exposure,
ताकि ये प्रोसेस बार बार
ना हो. जितनी देर वो स्टक रहेगा टीथ पे, उतनी जल्दी, उतनी बार the number of bacteria will act. So it takes about 30 minutes for acids to start forming after a sugar attack. So every time you had a biscuit in the morning, then you had a candy in the afternoon, you added a health drink to your milk, even that has a sugar content. So everything you are adding, it is getting stuck. As a rule, I generally say that we all would like to go out, eat something sweet, but once a week and in one go.
I'm going to come back to that कि हम वो control कर सकते कि नहीं. But मुझे एक और question mind में था that you are a dentist, you are a mom.
Yeah.
As a dentist mom, which is that one food which you'll never allow your son to eat because it's very harmful for dental hygiene?
So my son is 10 plus and he has never tasted cold drinks in his life.
Okay.
Yeah. So he's never had no colas, no aerated drinks. And again, so of course, some chocolates, dark chocolate sometimes is absolutely okay. Sticky caramelized candies, jujubes, those toffees which have a lot of caramel content, which will stay stuck and the sugar would, stay stuck in the grooves of the teeth, are completely avoidable.
So
most harmful.
Sticky candies and colas.
Yes.
Wow. Okay. Now coming back to कि junk restrict करना है हफ्ते में एक बार.
हाँ.
Now we know that is very, very difficult. हम try तो करते हैं, but I guess most of the times we fail.
Yeah.
And especially in few phases, जैसे holidays आ गए या festivals आ गए, the amount of junk intake increases. अभी बच्चों ने junk खा तो लिया. What can we do as a prevention after kids have eaten junk or sugary treats?
Correct, yeah. So first and foremost is make sure that they're rinsing their mouth after each meal. Let them have some water and not just make them just swish it in the mouth and swallow it or gulp it. Okay, so it will, but water will only remove the larger food particles, right? It will dilute the acids in the mouth to a certain extent, right? But it will not remove whatever is stuck in the grooves of the teeth, okay? So for that, best is again to give that junk along with something crunchy or savory, like maybe a carrot stick, anything which is removing whatever sweet is stuck onto the surface of the teeth.
Can you explain that, like how giving a carrot stick
with junk? So a carrot stick or a cucumber or maybe some corn, anything which is crunchy, broccoli for that matter, anything leafy, crunchy, which is going to wash off whatever is stuck. See, water will only remove the larger particles and the superficial layer. If you're eating something along with it, the sugar which was stuck, the chocolate which had gone deep into the grooves of the molars, if I may just show it to you here on the model. So these are the molars, the last teeth in the mouth. So the food, the sweet stuff is going to get stuck in these grooves. If you're eating something crunchy, that will help to remove it slightly. So that's the least you can do, when you are outside. Of course, if you are consuming something which is really very sweet and sticky, it is better to then just maybe use the brush and just wipe it off. But if you don't have access to that, then of course just stick to drinking water and eating something which will help remove the stickiness from the surface of the teeth.
But that's an amazing tip. Asha, tell me, are there any dental-friendly food which parents can incorporate in their kids' diet to support dental hygiene. Now, by that I mean, जैसे carrots are good for eyes, spinach has iron, then curd is probiotic.
Correct.
तो ऐसा कुछ है कि this food is great for your dental
Oral
hygiene.
cavity, yes,
Yeah.
for dental hygiene. So nuts.
Okay.
Nuts are a great source of protein, fiber, good fats, right? Then cheese, milk, dairy products. They all again help to neutralize the acidic levels, the pH levels in the mouth. Okay. Corn, popcorn, makhanas. Okay. Of course, green leafy vegetables, your, normal idli, upma, things like these. These also really help. So anything which is helping reduce the acidic levels in the mouth are really good. And kids generally love these also. So like I said, if you're giving something sweet, you add these things along with the sweetened meal so that, the balance in the mouth is maintained and cavities are reduced.
Great. And ये तो हमने food की बात कर ली. Now let's come to the main exercise of dental care, which is brushing.
Yeah.
Tell me, आप parents और children से इतना deal करते हो. What are the most common mistakes parents and children make when it comes to brushing?
So still, despite, still there is a lot of lack of awareness amongst parents at even in today's day and time. Nighttime brushing is still something which most of the parents and children don't do. And what happens is when they come, they meet, they'll get motivated, they'll do it for a month or two, but then again that habit goes out of practice. So nighttime brushing is one thing which I would want every person to, introduce in their daily routine, whether it's a child or whether it's a parent. And brushing the correct way, brushing for the correct amount of time, that is the correct technique, the correct amount of time, using the correct toothpaste, using the correct toothbrush. So everything matters. So if you are doing, so there are people who come and say, I'm brushing 2 times a day, still I'm getting cavities. But somewhere they're not realizing, are they brushing correctly? Are they using the right toothpaste? Are they using the right toothbrush for themselves or for their children? So that really matters.
So, is it possible for you to explain us what is the correct technique each parent should know for brushing their child? क्योंकि parents ही brush करने वाले हैं बच्चों को. So the technique, the angle, frequency, time, like I'm going to ask you everything.
Of course.
अगर आप ये बता सकते हैं, so it will be really helpful as a parent.
Yes, of course. I'll explain all of that, and then like you said that parents brush करने वाले हैं बच्चों को. I'll also answer that question separately for you कि कब तक करना चाहिए, क्यों करना चाहिए और कब हमें ये stop करना चाहिए.
तो पहले आप टेक्निक बता दो कि किस तरीके से हमको करना चाहिए.
Absolutely. So I have got a model with me just to explain it to you. So we generally divide the mouth into 2 parts, the upper jaw and the lower jaw. And further, each jaw is divided into 3 parts. So just to make it simple, I tell the children the front teeth and 2 sets of back teeth. Similarly, in the upper jaw, the front teeth and 2 sets of back teeth. Now, I'll tell you the ideal theoretical way that is to be done, and then I'll explain you a simpler modification of how we can explain it to the children. All right. So we always have to keep our brush at an angle of 45 degrees. Okay. When you do that, you vibrate the brush for about a second or two so that the bristles engage themselves in these areas between the teeth. Now, when you do that, you vibrate it slightly. For the lower jaw, you go from bottom to top. Okay. So you have to remove the dirt. Now, generally what more than half the population does is this. Correct. So the horizontal brushing or the scrub method, it's the worst form of brushing. What it does is it, recedes the gums. It strips the gums off from the surface of the tooth. Okay, so that is something which we are not supposed to do at all. Now again, theoretically and ideally, we are supposed to do 20 strokes like this, 20 like this, 20 like this, 20 like this. Again, on the inner part, you go 20 like this, 20 like this, and 20 like this. Now, the chewing surface is left. That you can just clean like this.
Okay, so we need to actually pull out the...
Yes, so you have to remove whatever dirt is stuck in a direction which is going from bottom to top in the lower jaw. It reverses in the upper jaw. So in the upper jaw, again, we keep the brush at an angle of 45 degree, vibrate, let the bristles engage, then go from top to bottom. 20 strokes, 20 strokes, 20 strokes, 20 here, and 20 here. And then we clean the chewing surface. So you have to make sure that your child is making sure that the toothbrush is reaching the last part of the jaw, towards the end of the jaw, towards the last tooth.
Got it.
Okay. And to make it simpler for children, because you can't explain to a 5-year-old that you make those angles and do this. So it's a simple circular technique of brushing. So if you see, when I'm making circles, I'm actually following the same pattern.
Got
right?
it. Yes.
So when we explain to children, we ask them to brush in a circular manner. And in simpler words, we always say that you have to brush every surface of the tooth. No surface of the tooth should stay neglected. Because wherever you won't brush, bacteria will come and start causing a cavity.
ये आपने टेक्निक बताया. What about the time? कितना time brush करना चाहिए?
Yes, so you should ideally brush for 2 minutes, 2 times a day. Okay. So what I again suggest is that either keep a timer, set an alarm on the Alexa, or just keep that sand timer. Or these days you have brushes with a timer, inbuilt in them. So use that.
आपने बीच में बोला that hard brushing नहीं करना चाहिए, and
Yes.
most of us we
Brush
our
really hard.
Our teeth, we brush our teeth really hard.
True.
So my question is that what are the adverse effects of brushing too hard on a child's teeth?
So see, when you're brushing too hard, what you're doing and most of us, like I said, are brushing horizontally. What it does, it strips the gums and it makes the gums recede. It develops a small concavity here, a depression here in the cervical region of the tooth. So it basically abrades the enamel from that area, leading to sensitivity, of course, recession of gums, sensitivity to hot and cold, and of course, eventually food lodgement occurs and cavities start forming in that region as well. So how much pressure to actually use is, it has to be firm but gentle, is how we say it. To experience it, what I tell my patients is use your non-dominant hand to brush. So then you will realize the difference in the pressure. And when you're brushing, you should feel the bristles on the surface of the tooth, but you should not really squash them. So that is how, with experience, when you're brushing, you'll get to know.
So parents can control that pressure. Now coming to something which you mentioned during the conversation, कि हम कभी brushing the teeth independently बच्चों को दे सकते हैं, that we can delegate that job to them, that now you can brush on your own.
So see, children should have fine motor skills before they are able to take the brushing in their own hands. Now, when do they develop fine motor skills? Is, when they learn to tie their shoelaces on their own. So generally that happens by 7 or 8 years of age. Or when they learn to, break a piece of roti and put sabzi in it and are able to eat on their own. Or maybe when they're able to button up their shirt on their own. So when they have that manual dexterity, when they have those fine motor skills, that is when they should start brushing on their own. Because if nighttime brushing is not done properly, like I said, parents most of the time don't brush their teeth and their children's teeth at night. At night, again, your natural defense mechanisms that I mentioned, saliva and tongue, they're also at rest. They're also sleeping along with you. You're not talking, so saliva is not being produced. You're not eating, or, so the tongue is also not moving around or cleaning the food from various surfaces of the teeth. So food is stuck at that point of time. That is when maximum cavities occur. So I always, tell my patients it's a party time for bacteria. You are sleeping, they are having a ball of a time because, they have no one to stop them. So it's very important to brush very well at night.
एक और एक चीज में पेरेंट्स को कंफ्यूजन होता है, which is selecting the right toothbrush and toothpaste. Or let me put it as age appropriate toothbrush and toothpaste. Also, there is one more thing which has recently come out, is whether the toothpaste should have fluoride or it shouldn't have fluoride. So can you explain us age wise as to which toothbrush and which toothpaste should be used right from being a baby to they using the adult toothbrush and toothpaste?
Of course. And, this is again a point where most of the children and parents go wrong and have a doubt on. Start cleaning the gum pads of the baby as soon as the baby is born. So even before the tooth erupts, the gum pads have to be cleaned either with a wet muslin cloth or with a gauze piece or with a silicone BPA-free brush. You just have to clean it gently. You don't have to go anywhere deep. Whatever is that you're just removing with a soft piece of cloth, it has to be clean. Your fingers have to be clean. So it has to be before the tooth erupts. Once the tooth has erupted, that is when you switch to a toothbrush. You don't use all these aids after the tooth has erupted, right? Now for toothbrush, for 0 to, you get age-specific toothbrushes in different brands. So of course, above 6 months of age, you use till 2 years, you use a 0 to 2 year old toothbrush. So of course, the head of the toothbrush, the bristles have to be soft. Those are the specifications. Any brush which has been approved by any dental association works perfectly fine as long as it is age appropriate. Then you can move on to a toddler toothbrush. Again, 2 to 5 years of age, 3 to 5 years of age. Different brands label it differently. Okay. And then above 6 years of age, you can move on to an adult toothbrush, a regular toothbrush.
Okay.
Now coming on to the quantity of toothpaste, right? So quantity of toothpaste for children below 3 years of age has to be a rice grain or a smear layer. So जितना चावल का दाना जितना toothpaste होता है उतना toothpaste आपने use करना है. Between 3 to 6 years of age, you have to use a pea-sized amount. मटर का दाना. So a small pea-sized amount of toothpaste. Above 6 years of age, you can move on to a 1 centimeter or say about half the length of the toothbrush. Okay. And after that, you can move on to the normal length of the brush. And every time you're applying paste on the toothbrush, you have to push the paste inside the bristles. So it has to go inside so that it can, properly foam and give its, be properly effective. Now coming on to the fluoride content. Now initially it was said that you should use a fluoride free toothpaste for younger children because they don't have a spitting reflex till 3 years of age. As per latest guidelines of International Association of Pediatric Dentistry everywhere across the world, it says that you can use a fluoridated toothpaste. So you can use 1,000 parts per million fluoridated toothpaste, which is actually the fluoride content in an adult toothpaste. But like I said, the quantity is what is critical. So if you're using a rice grain and even if the child is swallowing, it is absolutely okay.
Thank you so much for simplifying this age-wise because it will help a lot of parents to basically select the right dental care for their children.
Correct.
Now we are talking about toothbrushes. Are electric toothbrushes good ki manual ही better है?
So see, when studies are done, not a major difference is found between the two types of toothbrushes. What matters is the technique of toothbrushing. All right. So like if there is a stain on a cloth, right? And if somebody comes and asks me, मैं surf use करूँ या Ariel use करूँ, or any detergent for that matter, what would you advise? You would say you have to rub it properly so that the stain goes off. Just keeping the, it over there won't really help. Now, electric toothbrushes were ideally made for children, who were special children with some handicapping conditions or not having enough manual dexterity to be able to move the brush everywhere. But these days, people are using the electric toothbrushes. So it's absolutely okay as long as you are using it the correct way. You're cleaning every surface of the tooth. Generally, we recommend electric toothbrushes after 3 years of age, not below 3, because children are sensitive to the vibrations or the sound.
So the product doesn't matter, the technique
is what is more critical. Yes.
Nice.
Yeah.
अभी इतना सब information तो हमारे पास है. Okay, and as parents we're going to like really try to use all of this. But बच्चों को करवाना is another ball game altogether.
Agreed.
So, and you are so good with kids. The amount of patience you have, and I mean, they listen to you. I've seen that.
Thank you.
Please share some tips how we can make brushing, flossing fun for kids rather than a chore.
Yeah. So see, again, like you ask your child to take a bath every day, to go to the school every day, perhaps eat food, perhaps do homework, it has to be a non-negotiable activity. Come what may, wherever you are tired, you're busy, you are, not in the mood, brushing cannot be skipped. As a parent, you have to ensure that. Now, to make it fun, I tell them, the parents must brush along with their kids. Play some songs, dance, play some toothbrushing songs. So don't make it a forced activity. Just make sure that you're enjoying the whole process. So just dance around, sing around, play some songs, and do it together, so that the child doesn't feel that I am the only one who's being forced by my parents or the dentist has told me. So even when I'm consulting or teaching the children, seeing the children, I tell them, now it is your duty and your responsibility. You take the onus that you ensure that parents, mama, papa, are also brushing along with you at night. So then they'll take it up. Oh, I have got that. I am the boss in this situation, so I'm going to ask my mom and dad to take it up with me.
And kids love responsibility.
Yes.
They take it very seriously.
They take it very seriously. So at times when a child is not cooperating and he's saying that, I don't want to get this done, and parents are coaxing the child, I say, these are your teeth. You have cavities. You have to, from inside make an effort to do this. So you decide and tell me whether you want to get this done or you want to, otherwise you're going to, get into more problems later. So if you give that time to the child, and if the child listens, and when he feels, I am the one who is being given the authority to take a decision, they'll generally say, okay, I'm up for it. Please go ahead.
Okay. I came across a video of Dr. Sandesh Maikar, and he said that सुबह ब्रश एक्चुअली आपको ब्रेकफास्ट खाने के बाद करना चाहिए. Really, and why?
Yes, so he's absolutely right in saying that. The logic behind that is, if you're brushing at night, so this of course comes with the fact that you're brushing your teeth at night, the mouth is now free of any plaque or any stuck food on the teeth, right? When you get up in the morning and you eat your meal, and then after that you're brushing, and then you're not eating anything for the next 3 or 4 hours till your next meal, right? So your mouth stays bacteria free, plaque free for the next 3 to 4 hours. So ideally you should brush after breakfast. What we do is, all of us are in the habit of brushing before breakfast. We'll brush before breakfast and then we'll eat. Then that food is stuck onto the teeth for the next 4 hours. Again, bacteria get all the time in the world to start causing cavities. Another thing to add on to this is, do not brush immediately after having your breakfast. So there has to be a gap of 30 minutes.
Why is that?
Because when you are eating your food, again, acids are being produced. So in a 30-minute time period, those acids get neutralized, they get diluted. And when you use the toothpaste immediately, it's going to spread that around after the meal. And it's going to do more harm than good. So 30 minutes you wait after having a meal, and then you brush your teeth.
There's some amazing information we all are getting here.
I'm glad.
I want to go back to babies because my son Heather, he's 16 months of age, and मुझे babies के dental care के बारे में जानना है. Tell me, what is the effect of bottle feeding, night feeding, and thumb sucking on babies' dental health? We can take this one by one.
Yes, of course. So bottle feeding or breastfeeding. So normally breast milk is not going to do any harm. It's good for the child, right? And generally, the pediatricians recommend weaning the child from the bottle or the breast milk by 12 to 14 months of age. Okay. So till 6 months, it's pure breastfeeding. From 6 months to 12 to 14 months onwards, you have to start introducing other foods also. Now, when the bottle feeding or breastfeeding is done prolonged at night, without giving any breaks and at will, that is when it starts creating an issue. Along with having a sugary diet or a carbohydrate, fermentable carbohydrate rich diet during the day. So what really happens is, children, they suckle. They have a different suckling reflex. So whenever they are drinking the milk from the bottle, whether it's a natural nipple or an artificial nipple, the nipple is between the teeth and the tongue. The tongue protrudes outwards and then they suckle the milk out. That milk starts getting pooling around the upper teeth. That tongue generally saves the lower few teeth. And cavities start developing. Now, when this is happening at night, as we discussed earlier, the natural defense mechanisms of your tongue and saliva are not really acting, right? And the sugars in the milk, lactose is a natural sugar in the milk, that because it is getting accumulated at night, along with people don't start brushing, they think that these are milk teeth, generally they start brushing at a later age. So all these things together, they start causing cavities. So this has a terminology also which is called nursing bottle decay. Nursing is when the mother is feeding, bottle is when the child is being bottle fed. So not breastfeeding alone, not breast milk alone, but if it is done for a prolonged period, nocturnally at night, and without brushing, in addition to the other sweetened foods during the day.
So during the first year, bottle feeding is okay because
Yes.
बड़े लोग generally बोलते हैं अरे bottle मत दो दांत टेढ़े मेढ़े आएंगे. So all that
So till
is
first
okay.
year, it is okay. And you gradually wean off the child, right? And then you introduce the trainer cups, the sippy cups eventually. Yes, if you keep it prolonged, that is where, pacifiers and thumb sucking that you were mentioning. Till say about 18 months of age, if the child is on pacifiers also, it is okay. But if you continue the pacifiers beyond 18 months of age, because see, initially thumb sucking or pacifier sucking, it's an inborn reflex. Do you know when the child is in the womb, in 12 weeks in utero, the child is sucking his thumb? It's an inborn reflex. It's called a rooting or a sucking reflex. What it gives the child is comfort, soothing. It's soothing for the child, right? So it's gratification, satisfaction, feeling of security. So this will be there. It's normal for children to suck their thumb. But you have to help them wean off before they turn 3. So what happens when the thumb is inside the mouth? It is creating a pressure on the palate above. Now, there is generally a harmony between the muscles in the mouth, your cheek muscles and your tongue. Tongue is a very strong muscle. When your mouth is closed, so like we have a posture, there is a posture of the face. The posture of the face is lip sealed, tongue suctioned on the roof of the mouth, and breathing quietly through the nose. Okay, when you're sucking your thumb, what you're doing is you're putting pressure. These cheek muscles are exerting more pressure, and the tongue, which was ideally supposed to be suctioned on the roof of the mouth, is lying low. Right? When it's lying low, then the jaw development is not appropriate. So when the tongue is on the upper jaw, it molds the jaw. If the tongue is below, the jaw will start becoming V-shaped. The arch will start becoming narrow. Open bite develops. Open bite is, so if you saw in the model, the teeth are like this. The upper teeth cover a certain portion of lower teeth. When the child is sucking the thumb, of course not the right model to demonstrate, but the bite opens. And when the teeth have to erupt, because generally if it is prolonged, I've had children who have been sucking their thumb at 6 years, 7 years, 8 years of age as well. So the teeth, because the upper front teeth erupt at that age, they start erupting in a different manner. Buck teeth is what you call them.
So,
right?
Bottle feeding, night feeding, thumb sucking,
sucking.
pacifiers, between 18 months to 3 years, stop हो जाने चाहिए, नहीं तो dental problems होती हैं.
नहीं तो dental problems होती हैं. So your jaw alignment, your jaw development, your speech, mouth breathing, all these issues are interconnected.
Tell me, are there any particular signs which parents should look out for that indicate that a dental visit is required for a child? And I'm not asking about the obvious कि cavity है, दांत पेन हो रहा है, तभी तो हमको पता ही है डेंटिस्ट के पास लेके जाना है. But
correct.
Other than that, are there any signs which we as parents might not realize that this is a dental problem?
So see, before answering that question, ideally you must visit your dentist every 6 months. Okay, when you're visiting every 6 months, like I said, it starts as early as 6 months of age. When you're doing that, the dentist helps you to establish a dental home. A dental home is an ongoing relationship. It's a continuous relationship between the parent, the child, and the dentist, right? And the dentist will provide you anticipatory guidance, again, on oral hygiene practices, on how the jaw, grows and develops, on diet and nutrition, on speech and, the language, all those things, right? Now, when you're visiting every 6 months, you're not going when there is pain. So even if a cavity is beginning to form, you might not be aware of it. You would not have the trained diagnostic eye to figure it out. But the dentist would tell you about it and would help to nip it in the bud, along with doing certain preventive treatments as well. Now, other than if it's other than 6 months, of course, you're visiting the dentist at 6 months, what you can watch out for is maybe white chalky lesions on the surface of your teeth. So between the gum and the tooth, again, we call it the cervical region of the tooth, the neck part of the tooth. That is how a cavity initially forms. And that is when none of the parents are able to really understand that it's a
Mm.
cavity.
Mm.
So these are called white incipient lesions. Incipient because they're in the very initial, in the very nascent stage.
Mm.
That white chalky appearance will, if you don't go to the dentist, ultimately it will start breaking down and cause a big cavity. So once, if you spot that beforehand. Second, other than that, certain habits like we spoke about, if you feel that your child is breathing through the mouth at night, right, is snoring, or is grinding his teeth, or is sucking his thumb, for certain oral habits, so then you should not wait for it to start causing more harm and causing dental issues. You should visit the dentist before that.
Got it.
And of course, sensitivity or anything. So when you see, like you said, it's rest is the obvious.
Rest is
So
obvious.
rest is the obvious. Yeah.
We are at the end of the podcast, but I have to ask you this question.
Sure.
Please tell me, what's the effect of poor oral health on a child's overall health? Because generally, हमको लगता है कि it's just restricted to the mouth. But I would love for you to elaborate on the overall health
of the
Yeah.
So oral health is the mirror of general health in children specifically. So when they have a lot of cavities, has all decayed rotten teeth in the mouth, and he's not able to chew correctly, nutrition is not going. Nutrition, it starts from your mouth, right? It's digestion, nutrition, they all start from the mouth. So because he's not able to eat properly, it is affecting his growth. Other than that, it affects them physically, it affects them mentally, it affects them socially. I have had many young children come to me, our front teeth are all black. I don't like to smile in my pictures. The other child is making fun of me. Of course, we have to build their self-esteem and confidence. But barring that, somewhere it is affecting them emotionally as well. Absence from school, because of pain or an abscess. So somewhere the quality of life, it is getting affected. So if we take care of oral health, yes, definitely our heart, mind, body, soul, everything is going to be in unison and work absolutely beautifully.
So it's not oral health, it's
Yes.
overall health.
It's overall health.
Wow.
Absolutely correctly said.
And this is a beautiful saying to end the podcast on, but we are going to move on to a fun session, which is quick 10 with Zara. I'm going to ask you 10 questions and you have to give the answer rapidly.
Done.
Okay, ready?
Yes.
Okay. First one, what's your favorite dental myth that you love busting?
Milk teeth don't matter. They will fall off eventually. That's not true.
If you could give every parent one piece of advice for their children's oral health, what would it be?
Please brush your children's teeth at night. It's really very important.
What's your go-to snack for kids that's both healthy and tooth-friendly?
Nuts and makhana is what I go for.
Toothpaste for toddlers with or without fluoride?
As per the latest guidelines, with fluoride, but only a rice grain amount of toothpaste.
Okay, noted. What's your favorite way to make a dentist appointment less scary for a child?
So we call it tell, show, do. In the first visit, whenever the child comes, you would have seen it with Eliza as well. I like to do some magic, familiarize the child with the surroundings, with the dental chair. Just tell them everything that we are doing, show them everything we are doing before we actually do it. So enjoy, laugh about it, make them watch some, cartoons or something where they feel comfortable. And, I tell the parents also, please don't scare our children by saying, we'll take you to the dentist, he's going to give you an injection. Please don't. Once the child comes to us and he doesn't know anything about, what is going to happen, there is no anticipation. He's coming to us fresh. Let the pediatric dentist, mold his behavior and make it a fun, happy experience for him.
Chocolate or candy, which is the lesser evil for kids' teeth?
So again, the stickiness matters more. So a sticky candy would be far worse than maybe a dark chocolate.
If kids could understand one thing about their teeth, what should it be?
Well, to that I would say prevention is better than cure.
What's your stance on kids using mouthwash? Yes or no?
So mouthwashes are not recommended below 6 years of age because, adult mouthwashes are mostly alcohol based and they can cause dryness in the mouth. For kids, we have specific fluoride based mouthwashes.
Are there any common foods or drinks that parents don't realize are damaging to the kids' teeth?
Health drinks. Energy drinks. So, we feel that, they're going to give a lot of energy, but read the label. Everything which has sugar in it should be avoided. Fruit juices, for that matter. Fruit juices mainly. They think it is healthy. But, below 2 years of age, it is not recommended to give any fruit juice to the child.
And the last one, what's the most surprising thing you have learned about kids' dental care during your career?
Well, it's slightly unfortunate, but there still is a lot of lack of awareness. And I really wish that as a pediatric dentist, I'm able to reach out to every parent and every child. And like I said, that, what I aim is to see a cavity-free childhood for all the children in our country.
I really hope you reach your goal, and I really hope we all parents can help you reach that goal. And thank you so much, Dr. Jayna, for having this conversation, for educating us. You have given us some amazing pieces of information, and thank you.
It was an absolute pleasure, and I really hope that all this information helps as many parents as it can.
I'm sure that it will.
Thank you so much.
Thank you. That's it for this episode. Hope you all enjoyed this conversation and found it as relatable and heartwarming as I did. And if you did, don't forget to subscribe, write a review, or share it with someone who might need a little bit of a parenting pep talk. Thank you for tuning in. I'll see you next time with more real stories, laughs, and insights. Until then, take care and remember, you are doing great. Here is to surviving and thriving one day, one episode at a time.